Hey, thank you for listening to the coverage of the PrimeRx Xplore event 2025 user conference. My name is Todd Eury, founder of the Pharmacy Podcast Network. We have an exciting show for you.
You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to Xplore 2025, a three-part podcast series produced by the Pharmacy Podcast Network, capturing the highlights and insights from the first ever PrimeRx user conference, held October 10th through the 11th, 2025 at the Westin Jersey City Newport. Over 2 dynamic days, attendees explored the PrimeRx ecosystem, covering long-term care models, AI-driven patient engagement, DSCSA compliance, and the company's first integrated pharmaceutical purchasing workflow. Sessions and workshops focused on emerging trends and continuing education, equipping pharmacies to stay compliant, profitable, and future-ready. The event revolved around 4 key pillars: growth opportunities, cutting-edge technology, meaningful connections, and game-changing solutions, all designed to empower independent pharmacy owners. Here's part 1 of our 3-part series with host Todd Eury.
Ashton Maaraba here at the PrimeRx user conference, the Xplore conference. It was so good to run into you.
Oh, absolutely, Todd. And I have to say that it's the first time I've seen you MC a conference. So I was really impressed watching you up there on stage. So great job.
Oh, thank you so much. Yeah, it's an honor to be here for their inaugural event, talking with people that are wanting to level up. And part of that level up is doing things that aren't necessarily just the dispensing fee, but something that kind of dives into disease state management or tracking of a condition or really doing more for patients. And that's where iCare Plus comes in. So that's kind of why I was excited to see you. I wanted to get kind of an update on the evolution of iCare Plus.
Well, I'll tell you, first thing, just watching Katan, CEO of PrimeRx, on stage, and the speakers that we've heard so far, my hat's off to them and having their first ever user conference. I think the focus on non-dispensing revenue resonates, especially with what we're working on the iCare Plus side. Mm-hmm. A lot of our members align with their users, especially in the state of New Jersey. One of the big programs we launched collaboratively through iCare Plus and IPC Digital Health, LLC, which is a sister company to Independent Pharmacy Cooperative. And we operate like we've talked before. We are essentially another business unit that's part of IPC. I'll tell you, with our programs on the payer side, specifically in New Jersey, we teamed up with Clover Health in focusing on adherence fill rates, helping them achieve the star ratings that they need per patient, which they classify as a member, and leveraging our mutual partners, pharmacy members on the IPC side, and then obviously PrimeRx users. This is exactly what we've been working towards when we first laid the foundation for IPC Digital Health and the value that we bring to our members. Working with the PMS providers like PrimeRx is really important. I mean, these guys are really the nerve center of how users operate when we're focusing on whether it's the script fill side, but more importantly now, which we now know more than ever, it's that non-dispensing revenue. Yeah. So a lot of how iCare Plus has evolved is really to take advantage and leverage that non-dispensing revenue opportunity for our mutual members. So we really struck, we resonated across the healthcare community over the last year. And when you talk about collaborative care programs and value-based care and the tools and solutions that iCare Plus delivers to our member pharmacies, working within the pharmacy system like PrimeRx being fully integrated into pharmacy workflow helps us optimize the return on investment that our members are making for these types of programs. And not to mention, it really puts them in a position to successfully operate and reach the goals of a Clover Health type partnership that's being driven through IPC. So when you ask me how far we've come along, we always talk about our 5 pillars. of IPC Digital Health, the product itself. And it's something that our marketing team is working on revamping right now, so hats off to them. I mean, we firstly laid the foundation of our 5 pillars. It was all product-based, but now obviously we've evolved as an entity, so we're revamping that strategy, but the product pillars will always be the product pillars. One key product pillar, or actually 2 pillars, revolved around telehealth, remote patient monitoring, and then the tools and solutions that we provide to the pharmacies so they can actually address the non-dispensing needs of those members, of those patients. And it's gone really well, to be honest. We're very, very impressed with the participation rates. Of course, we can always generate greater volume, and that's something we're working on right now. You know, these stores have been through a lot over the years. Yeah. They've had a lot of programs come their way. They've been made a lot of promises that vendors or health plans that just have not delivered on, and we really found where that problem sits and why that was the case. I think when we at IPC and IPC Digital Health worked together, and we took the position of administering these types of programs, that's a key conduit. So offering a white glove solution, it's not just the tool and the solution, it's also the hands-on practical touch points that we provide, which has really helped the iCare Plus brand take off and really kind of continue its steady incline. Todd, we're still taking baby steps. You know, Rome wasn't invented in a day, and the Titanic didn't turn on a dime. As you know, and just things we've talked about before. So,
yeah, I'm excited to hear more about digging into some of the successes of your pharmacies that are using the systems and continuing to expand. I was so excited to hear about remote patient monitoring. Yep. The future of long-term care is going to be long-term care at home, and our community pharmacies that are preparing themselves with systems and with drivers and delivery, and like they're preparing for that opportunity. You're going to have a platform like iCare Plus to kind of be a central point. Yeah,
we've come a long way because we've even learned a lot. You know, our goal was always, we draft a business, we were very methodical in how we develop this, and sometimes when you're extremely methodical, you know, there's a lot of disciplines in place, and it does take a little longer to get off the ground, but if you really want that sustainability factor, you have to follow that methodology. If not, what'll happen is it's almost like an end cap at a store. You just kind of throw something out there, and it may end up in the discount bin after X number of months, and so that's kind of our biggest fear and our big motivating factor. Don't end up in the discount bin. Develop something, a brand that lasts and that's valuable. Value takes off in different parts and in different levels. And it means a lot to, it means something different for each member. And when we're talking about independent pharmacies, they all have their own culture, but there are some common denominators that we all appreciate. When you talk about the tentacles that make up iCare Plus, yeah, you're right. I mean, we have people that are using our product today, the solution, and they may not have had a lot of traction on the telehealth side. They may not have been able to. They haven't taken the next leap to remote patient monitoring and chronic care management yet. Biggest fear for some of our members are approaching those doctors. But it's like one of the speakers said. I think it was forgot his name, to be honest, but he owns 11 pharmacies, and I mean, he said it best. He said, "Look, he's like, I have 50 patients that this doctor is treating down the road. I take those 50 patients to the doctor and say, look, let's engage in a collaborative practice agreement. I'm already treating these patients. You're treating them. There's certain things that I can do that you don't have time for. Let's get together. Let's draft this collaborative agreement, and let's really kind of focus on their outcomes." That is one aspect, one of the tentacles. Things like medication delivery supplement, our integration with Uber Direct, which is a sister company to Uber, and their Uber Health strategy. We have stores, like I said, that aren't even using the telehealth side, but supplementing the usage of iCare Plus with medication delivery. We've been able to structure some really competitive pricing models, and we're seeing a lot of traction there. We also have a cash card, which is the iCare Plus Script Pass script card. I mean, when we first, our real goal was to encapsulate this ecosystem of digital healthcare solutions and build that viable onboarding center called iCare Plus Virtual Healthcare Center in the stores. There are stores that have showcased the center. Some are seeing traction. Others are still kind of building, learning how can we really leverage this within our everyday ecosystem. How can we retain the value that it's supposed to deliver or maximize the value, such as the rebates that IPC pays out or digital health pays out that are tied to those encounters? We can do that within our member co-op. We have stores that are just killing it when it comes to the cash card. They obviously have a patient base, and they're comparing the reimbursement that they're getting on the cash side. We have stores that are now really starting to take advantage of patients that need prescription refills and are just leveraging the platform on the telemedicine side, leveraging our telemedicine doctors. Just for those types of scenarios. And then like we said, we're just scratching the surface with remote patient monitoring, but we have officially launched. There are stores that are learning what it takes to adopt our policy and procedure guide. It's getting your store in the right position to be able to do what the speaker said today at the PrimeRx conference. Look at your patients that are in the system, tie them to the local doctors, and don't be afraid to go to the doctor and say, I'm already treating these patients, but we can do so much more, and I can generate revenue from that. I have the onboarding center at the store. I have access to interoperable blood pressure devices that I can get through our wholesaler that's driving this program. I have the data, and most importantly, we have an innovative provider of these services that's put the pharmacist front and center to create the care plan and approve the care plan, so doctors don't have to do that anymore. And that's a big difference between what our platform does and what traditional RPM platforms don't. Traditional RPM platforms are built around the doctor and only the doctor. And so what happens is doctors can take 2 to 3 weeks just to go into the system, create a care plan for a patient, and then pool the caregivers and all the providers together, versus the iCare Plus program where the pharmacist is the primary caregiver, or the pharmacy staff or whoever they delegate to administer the program at store level. They can go in there, they can create the care plan very easily, they can adopt it into the system, and before you know it, you have this brand new case, and you have the CPT codes built into the platform that they can set up billing against. Now, collaborative practice agreements are designed so doctors, pharmacists get together, they agree on certain principles. Many of our pharmacies already have CPAs with doctors for vaccination administration. In this case, all they have to do is add an extra bullet point that basically says, hey, we're also going to focus on these conditions. Let's say in our case, hypertension. This is the split in fee. And then all our pharmacies do is pull a report based on all the automated data that gets registered into the report. They send it over based on the number of encounters that have persisted. All of our encounters are consistent with what CMS requires for appropriate billing. The doctor bills, then the pharmacy bills the doctor. So I know it rolled right off my tongue, but that's how simple we've developed this program. We have to preserve the integrity of the brand. So obviously if there are doctors that are not paying the pharmacies back for the work that they're doing, and believe it or not, these are some things that I've heard have happened with traditional models. Yep. We also credential the doctors, but the difference is that the doctor comes in under the pharmacy clinic. As opposed to traditional models, the pharmacy was registered to the physician's clinic. That was very hard to make happen. And these are things that we realized. These are things that we noticed. Those were the details that we analyzed and said, it can't operate that way. If we're going to be another Me Too, this isn't going to work. Right. We have to put the power of remote patient monitoring and telehealth in the pharmacist's hands, in the pharmacy staff hands. The other thing that one of the reasons why we're here, obviously to support PrimeRx, but it's the integration into the workflow of the access tool. So there's the pharmacy system, that's software. There's the physician EMR, that's software. And then there's what we call middlewares, right? The software that sits in between the two. That's what iCare Plus is when you talk about remote patient monitoring. It's a fully flushed out solution that sits right in between the two. Plus, I didn't even mention the payer yet. Payers have no way of interacting with pharmacies at all. And when they do interact with the pharmacy system, they don't always execute because they don't really know our pharmacies the way we do. That's why IPC sits as kind of like that middle custodian to help triage those programs. And we've invested heavily in that. I mean, the personnel on my team specifically, the costs involved with investing in those types of resources to basically cater to the pharmacy for successful cases that are being processed through remote patient monitoring. That is something we committed to, and that is the non-dispensing side of pharmacy that we're heavily focused on. At IPC, we've got the drug distribution side, which is a very strong part of our program, and it's really what's made IPC what it is today. And then all the other benefits that IPC offers. And then there's the adherence side of the world. Digital health sits on the adherence side of the world. We have the dispensing side, and we have the non-dispensing side, and that's really what it's boiled down to, Todd.
That's great. Ashton Maaraba here at the Xplore 2025 in Jersey City. Thanks so much for sitting down with us.
Anytime, Todd.
Here at Xplore 2025, the PrimeRx user conference, I'm here with Leo Gjoni from DrugLift. Welcome to the show, Leo.
Thank you for having me, Todd.
All right, let's jump right in. What does DrugLift do? How does this application, how does this system, how does it fit in the realm of our independent community pharmacies?
Yeah, great question. So just to give you a little backstory, we launched in COVID time, June 2021. It was a complete shutdown. What we really do is we help out pharmacies get patients their medication. We are a door-to-door delivery service. To date, we work with over 600 pharmacies in New York City and surrounding areas. Actually, this is our first show ever. To date, we've grown...
Congratulations.
Thank you. We've grown entirely from word of mouth, just warm referrals from our existing clients. What really made us stand out from everybody else that was in the space is even though we do deliveries, we really act as a customer service company first. We really go above and beyond to ensure that patients get their medication delivered in a professional manner and that the pharmacy has a seamless experience, because deliveries is tough, especially in New York City, and it's much easier for pharmacies to use a service like ours rather than hiring a bunch of drivers, because now they have to manage a fleet of drivers, or a driver doesn't show up, or by using a company like us, a pharmacy can deliver much further than they otherwise would with their own drivers, because we deliver pretty much everywhere in the tri-state area.
Okay, I want to talk about the ecosystem, which is known as long-term care pharmacy at home, and the expansion of home care services, which is the future. We're not at the pinnacle of baby boomers from a demographic perspective. I think we hit that in the next 10 to 15 years, okay? So now we have this runway to get prepared for more home care, for more home delivery. So talk to me how you help a community pharmacy kind of navigate and restructure maybe some of their workflow, or maybe how you're tying in with their pharmacy management system. But talk to us about that side of the logistics.
Yeah, so we are, this is the PrimeRx conference. We're fully integrated with PrimeRx. Essentially, the pharmacy will set up deliveries, whether it's, in many cases, home care. We do work with many home care first pharmacies. They'll set up the delivery in their system, which automatically creates a delivery ticket in our platform. At that point, the driver will go pick up from the pharmacy at the pharmacy's specified time, and then the delivery will occur by that driver to the patient's home, and in many times given to either the nurse aide or whoever is helping out the patient.
Very good. Okay, so also describe, I'm a busy community pharmacy owner. I'm here maybe in New York City or a suburb of New York or New Jersey. Very busy. Tell me about an implementation program. How do I go from not really having a good delivery system, or I'm trying to do it myself, but it's not really what I want it? How do you strip out my existing infrastructure and what I'm used to doing, and how do you inlay and put in DrugLift? Or DrugLift?
Yeah, great question, actually. And the way that we do it is pretty simple. You go on our website, DrugLift.com, you click the Contact Sales button, you fill out the small questionnaire, which is basically pharmacy name, pharmacy phone number, address, and the person of contact. Somebody from our team reaches out, I want to say within an hour or two. At At that point, we create an account and boom, you're ready to go. There's no learning curve. It's as simple as you set up a delivery. We handle everything else. We offer same-day delivery and next-day delivery. Pharmacies have the ability to select a time window as well. So if a patient is going to be home between certain hours, we'll ensure that we deliver within those hours. And at that point, the pharmacy really, the only thing that they have to focus on is just in terms of what's happening inside the pharmacy, and let us handle what's happening outside the pharmacy. At all times, we're in constant communication with the pharmacy. The pharmacy has final say when it comes to everything. If for whatever reason a patient is not home, a member of our team contacts the pharmacy, asks us to call the patient. We do whatever it takes to ensure that the patient gets their medication delivered on time and gets the care they need.
So, Leo, that's kind of like the customer service piece that you're speaking to.
Exactly. So,
That's great.
it's very easy to say that we're a delivery company, but we wouldn't have gotten to the growth that we've achieved in the last 4.5 years if it wasn't for this extra layer of a very hands-on, in-depth customer experience.
Okay, you ready for a curveball?
Let's go.
All right, here we go. So Uber Health, Lyft Health, some of these big multi-billion-dollar transportation companies are getting deep into patient care delivery, taking people to their doctor's appointments, kind of like white glove service, and some people can afford it. Like some people out there have the money to be able to kind of invest in this. Do you ever see like the evolution of a DrugLift getting into additional services in the future where you might be doing like a patient delivery to a doctor's office or something?
I never want to say never. However, that's certainly not our focus today.
Yeah.
Uber has their strengths. Lyft has their strengths. Again, never say never. We've been contacted regarding if we offer these services. However, right now our focus is certainly on continuing to do what we currently do good at, which is ensuring that patients get their medication delivered to wherever they are on time.
All right, pharmacy owners, listen, if you have your own delivery drivers, if you are thinking about this, I want you to do a cost analysis. Call up the DrugLift team, druglift.com. Let them know that you heard the show at the Xplore 2025 podcast follow-up show. Reach out to Leo and the team and get your own information to see if this can help you. Leo, this has been awesome. Thank you so much for being here.
Todd, thank you for having me.
You're listening to the Xplore PrimeRx Conference 2025 here in Jersey City, New Jersey. The future of pharmacy. Wow, what a subject. We used to have a show called The Pharmacy Future Leaders, and just so busy we weren't able to keep it up. I want to introduce Ayah, who's a P1, and this is a pharmacy student that is born into pharmacy with her mother, Agata. And tell me about what, introduce yourself to the listeners, but then share with us what you're excited about in the profession.
Of course, yeah. So thank you for having me in this podcast. My name is Ayah Elzibak, and I'm a first-year student in pharmacy school. I have been working in pharmacy ever since I could work.
Yeah, that's what your mom told me.
Ever since I could work, it's the first job I had, and even before working, I would volunteer there. Even as a kid, I would just go there, with my siblings after school, so I know. I've had pretty good experience in terms of pharmacy, and I've seen a lot of different things that happen in pharmacy that, usually children or high school, middle school students, or even college students don't get to normally see. And I guess it kind of opened my horizons a little bit and got me more experience in this specific field. And I guess in terms of the future of pharmacy, there's a lot that could happen, especially now with AI. Yes. And I really just want to mention this because I know, AI is gotten big, and not just specifically with certain careers like in pharmacy, but I think that we can use it really well. And I'm just interested in seeing how different aspects of pharmacy, different fields, different pharmacists specifically, hospital, industry, clinical, community chain, how do they integrate and, use AI to help them better their pharmacy itself, or their patient care, or I guess their technology, or their software system. And I don't know, for me it's just a topic that kind of interests me a little bit.
Yeah. Tell the listeners, just in case they don't know, your mother's name and the pharmacy that she's built. I think she's done compounding, community, long-term care, but tell our listeners about that.
Yeah, of course. My mom's name is Gara Abuquake. She started off our first pharmacy, CureMed Pharmacy, in Clifton, New Jersey. And way back, this was way back in 2015, 14, I believe. It was a really long time ago. And a few years passed, we started doing different compounding, specialty pharmacy. We got different accreditations, the URAC, part of NCPA and all that. And then we started a new pharmacy called Symes Pharmacy, and it's located in Patterson. So all of our pharmacies now are in New Jersey. We have multiple locations, but the pioneer was CureMed Pharmacy, followed by Symes. And so I just really wanted to mention that because, my life was CureMed Pharmacy.
Yeah.
I grew up CureMed Pharmacy. That's all, I guess. That's the main reason why I'm here today, I guess. It piqued my interest to be, to be working even in a field like this. And to be honest, when I first started, I kind of didn't like it.
Probably, because it's like something you've been around for so long. It's like you probably rolled your eyes when your mom's like, hey, you want to come to the pharmacy and do this, and you're like, But then I was talking to your mother when you were talking to some of the vendors here. You have an advantage that other pharmacy students do not have. You have context, you have application, you have knowledge that's been woven into you from a very young age to just be part of this. And I think you're going to be able to do things in pharmacy that other pharmacists won't be able to do as quickly because you've been soaking in it for how many years now? Over 10 years probably.
Oh, I feel old when you say that.
When you say that, I know. But what about entrepreneurship? Have you ever thought that you might want to take what your mother's built and maybe take it to another level?
For sure, 100%. That's kind of been my leading motivation. And it's not just for me. It's for my mom, but it's also for the patients, the community that we have built. We have some patients that I've seen every single day come to our pharmacy for years, ever since we opened. Yep. And, it would be, I would be heartbroken if my pharmacy wasn't still, or my mom's pharmacy wasn't still there to help these patients. I don't know where they would go if it weren't for us. We've helped them so much. CureMed Pharmacy, my mom, there's so much more to give. And I feel like it would be a letdown if I haven't, considered my options in terms of continuing the pharmacy itself in the future. So for sure, I've thought about it a lot, and I think it would be very huge for me. And I think I could, you're right. I think I could do a lot in terms of what I've learned so far for the future of not just my pharmacy, but I guess other pharmacies as well, because, I'm here to help no matter who it is, whether it's a patient, myself, or, other pharmacists that are in need of it as well.
Well, that's beautiful because that's the heart of your mother. I have been a fan of her for over 10 years now. Every once in a while I try to get a selfie with her for the next time that we get together. We always see her at the NCPA. This is special, so I want you to give a shout out to your pharmacy school, and then I want you to promise me that you're going to bring me a couple of your students over the next 3 or 4 years to be part of a podcast.
Honestly, I would love to, and I'm not sure if you need me to mention exactly the pharmacy school I'm in.
Yeah, shout out your pharmacy school.
Yeah, sure. I go right now to Fairleigh Dickinson University Pharmacy School, FDU, so shout out to them.
Yeah.
It's been only a month, but here I am, and so far I've learned a lot, and I've connected with many of the peers over there, so hopefully soon, I can bring them into this podcast. I got the information. I'm going to share with them this podcast, maybe send them a link of this podcast we're doing right now.
Yeah, exactly.
It'll get them a little interested, and hopefully we'll see what happens from there as well. Yeah.
Well, I thank you for being part of the show and being here at the first Xplore 2025 event, and it was so nice to meet you and looking and meeting the future of pharmacy.
Of course, yeah. Thank you so much, and thank you for having me in this podcast as well. It was really nice to be here. Thank you.
Will Tuft here at Xplore 2025. Will, welcome to the show.
Yeah, it's been a great show. Enjoying being up north where it's actually fall here. So
it is.
Yeah, it's been a treat.
In Jersey City on the water, and last night was a clear night. It was gorgeous. We got to see New York City from one side, and it's just this is a high energy show. It's the first time that we've done Xplore with PrimeRx. It's fun to be here. Caden and his team are just charismatic. They're excited about what's going on. It's kind of where you fit because it's your same personality. But talk to us what you're looking forward to in the industry, as well as just some good news that's coming out of RxSafe.
Sure. So, Eyecon RxSafe, I joined the team back in July, so it's been a crazy summer already on the trade show circuit and hit the ground running with a lot of great ideas. And so that's been the most fun thing, that already have new features coming out here in October, and our first release since I've been with Eyecon. And really excited about just continuing to see innovation and to see, how can we better fill the needs of our customers.
So we just did a 3-part series with you. It's the first series in our long-term care at home initiative, because we want to bring more and more information to that. Let's talk about that subject for a second. Long-term care at home. So we're running out of beds at nursing facilities. We know that the baby boomers haven't even reached the pinnacle yet. It's still, growing every day, every month. Talk to us about the ecosystem of what that means. Long-term care pharmacy at home, and then the advantages in using PrimeRx and RxSafe in that mix.
Sure. So, there's obviously a large population shift, and right now, every pharmacy is feeling the pinch of low reimbursements, and it's very clear that you can't continue to do the same things that you've been doing and get different results. Yep. So there's so many pharmacies trying to find different ways to diversify, to get new contracts and work more efficiently, and that's all of that falls right into the realm of long-term care at home.
Yeah, so when I have talked to a lot of pharmacy owners who are making the shift and are just getting started, it's the contracting, it's the technology, it's the overnight coverage, it's the ability to transport the medications, get the medications. Talk to us about the footprint element of this, and that is, here's the scenario, and by the way, this scenario, this scenario, and that is, I'm a community pharmacy. I've been around for a while. I know my patients are aging, therefore I'm going to start talking about this. I'm going to make all the contract changes, but it's the footprint in my store. I don't have any room. So talk to us about a system that you would recommend that would fit the bill there.
Oh my gosh. So, working within your own walls, you're going to be looking for efficient workflow. You're going to be looking for small footprints. And RxSafe and Eyecon both happen to complement that goal. The RxSafe products have really small footprint that you can fit in, even in, these smaller, city pharmacies where any square footage is a real blessing. Yeah. So you have to be really mindful of that. But outside of that, you see even in rural areas, pharmacies trying to find new ways to do things. Maybe using their existing storefront as more of acute and moving even their retail patients into almost that long-term care workflow. Yep. Those predictable fills, your med syncs. Why are you surprised when that's happening? With phone call, it's coming. So. Those pharmacies that are finding an efficient way to do that, plan ahead, work smarter, work efficiently, it's more important now than ever. So.
Will Tuft, love seeing you at the conferences. Like I said, you're one of those people in the industry that's always. We all have things in life that bring us down, but your energy is always positive. I always like just hanging out with you, so thanks for being on the show.
Yeah, thanks for having me. Good to be behind Mike again.